So very exciting work, beautiful pictures and creative work, and I love the work that the architects are doing in design. And so, but I am going to switch gears a little bit. Let's see if I can get this right. And when several months ago, when I was asked to join this meeting and to give my topic, I thought, oh, this is a great topic. I'll talk about moving kids at home in preschool. That sounds really good. I thought that sounded exciting. And then I started thinking about what it's going to take to do that and do that in 20 minutes and have answers when I've got a lot of questions. And so I hope I can share with you some answers. I know that I will leave you with some questions, but I hope what I do is inspire you to pursue this, whether you're working in the community, working directly with children and youth in schools, or whether you are researchers or aspiring researchers. There's a lot of work to be done, and important work. Russ did a great job, so I won't have to talk really about the early childhood recommendations because you've seen this. NASB guidelines, which were the first in the U.S., really basically encouraged about 60 minutes for preschoolers of free play and about 60 minutes of structured activity, giving some encouragement for toddlers and infants as well. And then our international friends have really, I think, done us one better in terms of making guidelines that add to what we've already done and said, you know, kids really need a lot of physical activity, really more like 3 hours within the day. And then the work that Russ was part of that he shared as well, that child care needs to do its part. It needs to have a focus on promoting physical activity, and then children need to have to be encouraged and facilitated to be active, to be not sedentary, at least 15 minutes on the hour. And if you think, gosh, how does a little toddler preschooler stay inactive? Well, they've learned nicely in organized settings how to keep kids inactive because it's a controlling mechanism. So we need to figure out how we can change that around through some of our work, and I'd like to share some of that with you today. The area where I have more questions than answers is in moving kids at home. And although this sounds quite, you know, as a logical place to start, it sounds like it's ought to be pretty straightforward. In terms of the research that we have, it's really, we don't know a lot. Working with parents of young children, and as Art said, I'm going to maintain a focus on the 0 to 5 age group. And not always, but most of the time, young children have young parents. And so it's a young adult who has young children, and time is of a premium. Everybody's busy, but it seems like the young adult parent is especially busy with managing their home life, their work life, their social life, their extended family life. The demands are great with a younger child. These children have more dependency. They need more oversight. Safety is a real issue, and there's less structured opportunities for activity. The other thing is that we need to figure out, as public health professionals, how to engage these young adult parents. They have a lot on their plates, and perhaps increasing physical activity in their little one may not be seen as a priority, and figuring out how we can engage them is a real challenge. In the literature, what is developing, as Dianne said earlier, some of the work in nutrition has really preceded that work in physical activity in terms of what we know and how we work with children and families. We certainly have a literature that's developed in feeding practices. We've started talking about it as food parenting, how you parent around food. Well, this same idea is being developed in physical activity. It's called physical activity parenting, or parenting for physical activity. Kirsten Davidson and others have worked in this area and recently tried to conceptualize what are the parenting actions that seem to be associated with an activity outcome. And this was part of a conference that was held a couple of years ago in Houston to try to really focus in on these parenting actions around food and physical activity. In the physical activity area, what we were finding is that we're still not really sure what the constructs are. So in order for us to tell parents what they ought to be doing, this work is still evolving. And we also found that when we try to assess physical activity parenting, that we don't really have good measures. So it's a really difficult thing to operationalize, and so work in this area is continuing. Another thing to think about is the difference between parenting style and parenting behaviors. And those seem very similar, but a parenting style is how a parent engages with their child. And in the parenting literature, two approaches or two dimensions exist. One is referred to as demandingness, or it's a control factor, or some people will call it a parent-centered component. And the other is responsiveness or warmth, facilitation, sometimes referred to as a child-centered approach. And you may hear the term positive parenting, and that is a blend or combination of an adequate amount of demandingness and an adequate amount of responsiveness. And together, that results in what's known as a positive parenting behavior. But we do know that for some parents, they take on a different style in dealing with their children's needs. Sometimes these is often referred to as punitive parenting or authoritative parenting, my way, the highway. Higher in control and demandingness and lower in responsiveness. And there have been some indications in the literature that there's thought that a punitive parent must be a bad parent. The term punitive sounds pretty terrible. It sounds like you ought to call DSS and have somebody locked up. But I think it's really has evolved in some low economic families for a survivalist purpose, to keep children out of harm's way and safe and not messing around in terms of giving latitude toward child control. And so whether you've got, I don't think we should think about this as good parenting and bad parenting. I think we need to think about it as parents who find themselves in individual situations and parent in the way that they see is the best. I might add that there's also a third type of parenting that is oftentimes discussed. Some people will call it laissez-faire or inconsistent parenting, and it's when you have a little of this and a little of that, but nothing that's consistent. And I think that's may even be worse for children than having a parent who has these particular warmth or control characteristics. We were interested in this whole area of physical activity parenting, and we wanted to look at what was going on in the interactions between general parenting, parenting practices, which is what you actually do to support your child's physical activity, and the activity in the child, him or herself. So this is a project that we've been working in called My Parenting SOS. And we looked at about 300 child-parent dyads, measured parenting practices, and then measured child physical activity. And we didn't find a lot that gave us comfort that we knew what we were doing, but at least we've done a little bit in this area. And we found that positive parenting, if a parent was high in this positive parenting dimension, that they were engaged. So if you look in this middle area of supporting practices, that they exhibited rewarding their children with more physical activity, so that was a benefit. Modeling, and not modeling by mother going out and running 3 miles, but modeling by engaging in the child with active play and being part of that play and experience. Having family activities around physical activity, verbally encouraging and educating the child about activity. Activity makes your heart strong and makes you grow healthily. That would be a supporting experiences. We saw that with these positive parents, there was a lower association with rules and but a positive association with control over screen time. So it's not quite as intuitive as we would think. In terms of the punitive parents, what we saw, if you'll just again, I'm halfway through, so I've got to switch over in just a minute. If you look at just the supporting practices, less time spent with modeling, less time in family activities, and less time in verbal encouragement. But if you look in the controlling practices, more rules, more conditions about being clean outside, and much more conditions about going outside in certain kinds of weather. And in summary, what we were finding is that positive parenting works well with supporting parenting practices, but not with controlling practices. Inconsistent parenting style was sort of all over the place and was very difficult to understand which was the most appropriate behavior. And then punitive parenting actually, for those parents, worked a bit in the short run, but we don't know what it will mean to children in the long run. Our model didn't do very well. We didn't explain, but about 16% of the activity level in the children and a lower amount of the sedentary activity in the children. So this work, as I said, I'm full of questions in terms of this work, but I know that this whole area of physical activity parenting needs more work, and we need to look at the interaction between parenting style and parenting practices. So just to end up with my last part, which is what I know the most about, and I hope I have some answers for you. We've been interested in child care in terms of what are the standards of practice that provide the best experience for children in care. And I want to talk only about the physical activity part today. We published recently about what the best practice guidelines for physical activity at the child care setting should be. And for this study, we wanted to look specifically at 5 of these best practices. Having at least 120 minutes of physical activity provided for the children each day. Having occasions that the teacher led activity each day, that they joined in and were actually physically active with the children, that they had training in their background, and that they had written policies. So we wanted to test these. We went into 50 child care centers in North Carolina. About half of those participate in the food program. We were there for 4 days, and we collected observational data each day about what exactly went on. We were there before the first child came. We stayed till the end of the day, and we assessed the practices that were used in those child care facilities. And then we assessed about 10 children each day through accelerometry in terms of what was their physical activity levels. As I said, we did accelerometry. I also wanted to show that we assess the physical activity practices using a standard instrument that we developed a few years ago called the EPAO. And what did we find? Some of this may sound intuitive to you guys, but in the literature, some of this isn't really clear. We did find that in centers that had at least 120 minutes of physical activity, had about a minute per hour more of moderate to vigorous physical activity, and they had about a couple of minutes less in sedentary time. We found for those centers that had at least 2 occasions within the day of the teacher leading activity with their class, again, not quite, but a minute, close to a minute of MVPA per hour, and about 2.5 minutes of reduction in sedentary time. In terms of the staff joining in, we also saw an increase in MVPA per hour when staff were active with the children. We didn't find a significant difference in the sedentary, but the effect size was not too bad. It's about a moderate effect size for this. Now, where we weren't as successful in seeing expected outcomes, we didn't really see much at all, nothing here, and in fact, a reversal here in terms of where staff had had some kind of physical activity training. And then about policies, the criteria here were if their written policy at the center level had at least 4 references to physical activity. Maybe that would be children should wear appropriate clothing, we will go outside every day, teachers will have indoor activities. What it could be, we had about 9 different policies that could have been applied. But we didn't find anything in terms of physical activity or changes in sedentary time. I think intuitively the amount of time provided should be a given, but there are papers in the literature that show that if you add extra time for kids, they don't necessarily become more active. We found that it took 120 minutes. We actually looked at 90 minutes just to see if our recommendation of 120 was too much. And we didn't see that the beneficial effect of 90 minutes a day, so we feel really comfortable recommending that all child care facilities should assign at least 120 minutes. And if you think about the guidelines that Russ talked about earlier, both from the IOM and from the 3 different countries, for many children, the child care day is what they get. There's nothing else when they get home, and so if they need 180 minutes of physical activity, we're really having a minimal recommendation with 120. We want to continue testing this whole area about teacher engagement in structured activities. We do have some data, not showing it here, about how much time teachers spend engaging in physical activity with the children, and whether there's a dose effect about amount of time, and in terms of joining in physical activity, looking at that about time as well rather than just occasions. I think the whole area of physical activity training, the way we assessed the level of training was really pretty crude. Our instrument not only has an observation component, but it has a document review. So we were reviewing any of the printed materials that were in the documentation. And so if the documentation at the center level said that their teachers were trained in physical activity, then that was present. If it didn't say it, it was absent. So we don't know very much about what kind of training they've had. It could have been playground safety, which, as everyone knows, is a lot about what not to do, not about what to do. In terms of written policy, we've done a lot of work in this area, and the more work we do, the more head-scratching we have. We've got a paper in development right now looking at a whole range of different policies, and we've rated those policies. For this study, it was presence or absence, and a physical activity policy might be our children will go out every day, weather permitting. So it's a very minimal. So I think here we need to do more work in terms of really looking at quality. And you have policies that are often written and not implemented and not even communicated to the staff who are charged with doing that job. So I think we need more work in that area. So just in summary, settings and caregivers are very important. I didn't talk any about the physical structure and the social structure of the home. We've got a paper that recently published on the physical aspects of the home environment and looking at relationships with activity, and there definitely are some. But we do know that the parent as caregiver is an important connection to the development of physical activity in children. We don't know exactly what the constructs we should emphasize and with whom we should emphasize them. So this work is really ongoing. It's clear that child care centers make a difference in the activity level of children. This work has been shown by Russ's group, by my group, by others, both cross-sectionally, and here we're looking at this in a more of an actual observational study, looking at a practice and looking at activity. So we know that the child care center is an important place for improving physical activity. And lastly, if any of you follow any of the work that we do in my group, you know that we've developed a program for change at the child care level called NAPSAC, the Nutrition and Physical Activity Self-Assessment for Child Care. That we developed that over 10 years ago, and only this year have we come out with a 2.0 version of our best practices. We have a new snazzy website, and we actually have a new updated logo, and we'd love for you to friend us on Facebook and follow our tweets and join us in terms of promoting physical activity at the Child Care Center. I think the Child Care Center may be an important conduit to reach out to parents to try to help model together appropriate environments and practices to promote activity in children. Thank you.